I appreciate being invited today, Episcopal Charities does, to talk about the Matthew Project. And I'm sure most of you have some idea about it, but I wanted to just give a brief summary. The Matthew Project is essentially an out-of-the-ordinary Episcopal Charities Foundation grant. During the past few years, the board has been saying, we need to do something big, something different, something that's significant, something that will have an impact. Then a year ago, such an opportunity presented itself. During the ECF site visit to Good Samaritan, the conversation between Greg Talent, ECF board member, and Carole Maddux, executive director, took a turn. Greg asked, how else could Episcopal Charities help? And Carole started talking about the construction they were about to undertake for their new and much-needed health and wellness center. So an idea was born. Well, what if we partnered to build? What if Episcopal Charities would provide a framework and funding for mission trips for groups throughout the diocese to come to Jasper, Georgia and help build a new center? And the board was on board instantly. And during the past year, as we went through our grant funding process, we held back funds so that we would be in a position in January to hire a volunteer coordinator who would oversee the mission trip process. And in January, we did just that. We hired Hannah Phillips.
My job as the volunteer coordinator for the Matthew Project is to recruit volunteers to build this clinic. Right now, I am traveling around the state and around the Diocese of Atlanta, recruiting as many skilled volunteers as I can find. And when I say skilled volunteer, I'm talking about plumbers, electricians, drywallers, and other construction professionals. As we move into the less technical aspects of the project, such as painting and landscaping and construction cleanup, there'll be opportunities for other less skilled volunteers to help as well. We have further committed our board and our funding for 3 years. Our mission is the Matthew mandate, to tend to the least among us. And here, right now, today, specifically, for when I was sick, you took care of me.
Good Samaritan Health and Wellness Center has been here, open to patients for almost 11 years now, 11 years in April. We are housed in 7 trailers. I call it the biggest trailer park in Pickens County, which is saying something in Pickens County. We have 3 main double wides, another one we've added since I've been there, and a vision trailer. We are a free medical and dental clinic that also provide some comprehensive services. We do mental health, we have a pharmacy, we have a lab, we do imaging, echocardiograms, ultrasounds, eye exams, glasses, everything, because we serve the people who are within 200% of federal poverty level and have no insurance for the service they're seeking. Right now, our board, bless their hearts, have put aside money every year. We have about $260,000 toward the building. And that is what we plan to work with for this first phase.
Phase 1 building is located immediately adjacent to the existing trailers on an area that is open at the present time.
The Phase 1 building is designed as a 4,700 square foot facility with new areas for the pharmacy, the lab, the vision, and several examining rooms.
The Phase 1 building is the first of 3 buildings to be built to accommodate the needs of Good Sam.
And so it seems to me that that's the spirit here. What will happen to these folks who do not have the resources for quality care if we don't stop and partner together and get something done? So I just want to say from the bottom of my heart, thank you for this wonderful gospel expression of work in the real world, touching God's real people.
Since that wonderful groundbreaking ceremony, we received the disappointing news that a significant grant had been turned down. But it just reinforced with us how important it is for the whole community to come together in order to build this clinic, in order to make sure that these leaking, aging trailers are replaced with something clean and sturdy and worthy of our patients. We happen to be filming this on the 12th anniversary of 9/11. And I just have to say that my patients get hit with the twin terrors all the time of poverty and illness. And the wonderful response the church had to 9/11 through the stories of Courtney Cowart and Trinity Wall Street are inspiring to allow us to respond just that same way to the terrorism that happens every single day in our lives. That where we as a community can come together and defeat it and build a new clinic.